Hey guys, Alex here from HEXA Health Hub and welcome to our third part in this three-part triathlon injury series. In part 3 today, we are discussing the most common running injuries that we see in the clinic, how you can start to rehab them to get out of your pain, and then how we can use strength in the gym to help improve your running performance. Out of the 3 disciplines of triathlon, we most often find that triathletes will get an injury from their running training more than anything else. Plain and simply because there's a lot of load and forces going through the body when we are running. A lot more than you get when you're doing your swimming and your cycling training. One of the most common injuries that we see in the clinic is knee pain or runner's knee. That's where you get pain on the tendon as it crosses over the top of the kneecap. Now, a lot of the time you get associated muscle tightness into this tendon. So what we're going to do is show you how you can start to settle down some of that knee pain by using a really cool foam rolling technique. After that, once you're out of your pain, we can then go into the gym and show you some of the best exercises that we use to help improve your running performance. Over many years of treating endurance athletes and triathletes, we've found that this next way of using a foam roller to help loosen off the quads has been most effective at settling down pain the fastest. You only need to do this for a couple of minutes at a time and straight away you'll get up and feel an immediate difference with your knee pain. Get your foam roller, lay it down onto the ground, and you're going to end up in a bit of a plank position. So the opposite leg that you're not rolling goes out to the side to support a bit of your weight, but you want to try and put most of your weight on the leg on the roller. You keep the tip of your toe down on the floor, and then I want you to flick your heel in and out quite fast as well, and quite a far direction, far movement. You should feel it bump over a muscle down the front of your leg. All right, that's one of your main big quad muscles. Once you've done a few movements at that bottom portion just above your kneecap, shift down the roller slightly and keep going. There'll be a few points with this along your quads that feel worse than others. Spend a little bit more time there, but still make sure you go the whole length all the way up towards the front of your hip. Really shaking that heel in and out, working into the front of those quads, into that muscle tissue. Once you've gone all the way up to the top of your hip, start making your way all the way back down towards the knee again, keeping that toe planted and flicking the heel in and out. Once you've gone up and down, spending about a minute doing that one, start close to your kneecap again, bend your leg up and straighten it down. Bend it back up and straighten it down. So what we're doing here is keeping pressure on one part of your quad and then gently stretching and contracting the tissue underneath that point. It's called an active release technique. Really, really good, simple, and very effective release technique to get stuck into those quad muscles. Now, you can make it even more difficult by doing that rotation movement or rolling across your muscle to find the point that hurts most before you move your leg. Then once you've got that, bend your leg up and down, and you'll feel a bit more pain with this, but no pain, no gain, right? This is good pain we're talking about. Roll down a little bit, roll side to side, find a point that hurts a bit more, bend your leg up, and back down. And if you really want to get brutal with this, the weight of your own leg might not be enough, then you can get someone to put some pressure through the back of your hamstring down into the roller while you bend your foot up and down. So you're going to spend about a minute doing the first part of the movement where you're shaking your foot side to side just to break up some of that muscle tissue and loosen it up a little bit, and then maybe a minute to 2 minutes bending the foot up and down. Afterwards, stand up, do a few squats, do a few lunges, and compare it to what it was like at the start. Guaranteed your knee's going to already start to feel better. Many of the athletes that we see in the clinic that are presenting with knee pain specifically from running are very anterior chain dominant and lacking in the posterior chain, meaning that they are working and using their quad muscles way too hard when they're doing their running compared to the imbalance of the muscles that they have in their posterior chain through specifically their glutes and their hamstrings. So what we want to teach them how to do is strength exercises to improve the capacity of your glute muscles. Now, a lot of the time people can go and see a health professional like a physio or an exercise physiologist that will get them doing a lot of banded work where you put a band around your knees and you're doing sort of sidestepping work or laying on the ground on your side doing clams to build up some of those muscles in the hips. That will teach someone how to feel what it's like to contract that muscle, but it will not help you translate any strength that you feel like you've done or improved on from doing that exercise into something specific like running. When you run, you're using these muscles up on in your hips to keep your pelvis steady instead of letting it drop and sink down. Okay, that's the first one. And then the second one is using those big glute muscles to extend through your hip and drive your body forwards. So what we need to do is teach you an exercise that while on your feet, so in the functional position for running, and not specifically on 2 feet, but on 1 foot, how you are going to be extending through your hip to get your gluteus maximus working really hard. And secondly, how you're going to use the smaller stabilizing muscles in your glutes to make sure that your pelvis remains nice and stable. Everybody knows the exercise Bulgarian split squat. That's a very quad dominant exercise, so we're going to change it up and vary that movement into a hip hinge pattern of movement. The Bulgarian split squat has quite a long stance, and you stay upright through your torso and lunge up and down. We want to shorten your stance up, back foot elevated onto a slight step. From here, we are hinging at the hip joint, coming down and then back up. Hinging at the hip joint and then coming back up. I call this exercise the Bulgarian hip hinge. We have to be very, very specific with this exercise. A lot of the time you'll get people saying, activate your glutes, try and squeeze them. That's not going to do anything. If you want to work a muscle, you have to set yourself up into the correct position to use that muscle. There is no way you won't get your glutes working if you're in the right position. They have to work. A few key points when getting set up, and it's all about the setup. When you start going down into your hinge, your stance knee is not allowed to go forwards in front of your ankle. So your shin has to stay vertical. So we're not coming here, and we're not going backwards. Your shin stays vertical. From here, hips sit backwards. Now if my hips are sitting backwards like this, yes, my shin's now staying vertical, but I've got way too much weight on my back foot. The back foot here is just a stability leg, all right? It helps you keep a bit of balance. We want all of the weight on the front leg. The only way to keep the weight on the front leg while the hips are going back are to now counterbalance by shifting our trunk forwards. So as the hips start to come back, trunk starts to come forwards. Here comes the next tricky bit. We don't want your back rounding. If I'm rounding my back when I come down into this movement, I'm now taking pressure and tension off of my hamstring and my glute muscle group. If I tilt my hips forwards or anteriorly, as I go further down into this movement, that will allow my lumbar spine to stay neutral or straight. That will keep tension in my stance hip. Hinging the hips back, staying extended through my thoracic spine or my mid-back, and then up tall. They're the first 2 key points. Knee stays vertical on top of the ankle, so the shin bone is straight up and down. And then as you're coming deeper into the movement, you are tilting your hips back further and further, or tilting them forwards further so that your spine stays nice and neutral. That's going to help you get set up into a position to use your bigger, more powerful gluteus maximus to do just a pure hip extension movement. The really tricky part now is making sure that your pelvis doesn't rotate or drop. If I get set up into this same position and I come down into the Bulgarian hip hinge, down here, this right pelvis has now dropped below my left one. That is taking pressure off of my left hip. If I contract my left glute harder, that will pull my right hip back up to the ceiling. So what you want to find yourself doing with this exercise is as you hinge down, you're keeping the right hip the exact same level as the left hip. That's the first part. The second part of this is making sure that your spine stays vertical straight down through the middle. So I'm not coming down and shifting to the side, or I'm not coming down and keeping my shoulder straight, but then my hips twisting. So there's 2 movements to control through your hip stabilizers, the up and down movement and then the rotation side to side. As you come down, hips stay the same level, and I'm making sure I'm not twisting side to side. If you get all of those moves correct, and you're not compensating, there is no way you will not feel your glutes strengthening and working really, really hard in this exercise. Now, we use the Bulgarian hip hinge in the clinic as one of our primary exercises at helping to build functional running glute strength. But it is not the #1 best exercise that we use to improve running economy and running efficiency long term. This is our base builder. This is our building blocks. We start with this and then we progress to more advanced exercises further on from there. If you want to know what those further on advanced exercises are, you'll have to come see me in the clinic.